This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Hey EMM, we are excited to announce that we are now accepting applications for our second annual Diversity and Inclusion Award. The award is eligible to fourth-year med students identifying as underrepresented in medicine and are applying to EM residencies. We are extending 3 $200 awards to selected individuals following a blinded review of all applications. Applications will be accepted through the end of November, with winners being announced mid-December. Check out our website at www.emergencymedicalminute.org/EDI-award for all the details and to access the free application, or you can click on the link in our show notes. Thank you.
All right, well, hello, everybody. So, for years, there's been a general question about EMS transport and, how much should get done in the field and what level is the best EMS care, whether it's ALS or BLS for certain kinds of patients. And there was a recent study that I wasn't even aware was a thing of comparing police transport versus ALS transport for penetrating trauma patients. So apparently this is becoming a common practice in urban areas across the country. Kind of makes sense. Police are usually the first ones on the scene. They can get there quicker. And, sometimes these patients just need to get to the hospital. So this was a fairly large observational trial or observational study. It wasn't randomizing patients to either get police or ALS transport, but, it looked at the difference, patients who were already getting one or the other and compared mortality. And, this was a fairly large trial looking at over 1,000 patients. About 20% of them were transported by police. These were penetrating traumas to the torso or the proximal extremities. So what would we consider trauma activations? And they looked at the overall mortality rate, and there was no difference. It was 15% in both groups, so pretty sick patients. And then they looked at the most severely injured patients. And again, in the group that had the most severe injuries, there was no difference. They were both around 38% in terms of mortality, whether they were transported by police or ALS. So apparently this was done in 25 major urban areas across the country. So perhaps maybe we'll start seeing more police transport of really sick penetrating trauma patients. It'll be interesting to see and take a handoff from police with a sick gunshot wound, but maybe that's a thing that will be happening.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.